Hi, I'm Dr. Rajani. Thanks for joining me today. Botox will droop your eyes. Unless it's happened to you, you may not know that. And in fact, people go to their injector and they say, inject me up here. Everyone else does. I want the brow lift. Totally erroneous. Patients don't know, and how would you? What you know is you want a smooth forehead and you want the Bella Hadid lifted brow, or at least you don't want to droop it. But any Botox or Botox-like products, Botox, Dysport, Xeomin, Jeuveau, will lower the forehead, will lower the brow, give you the brow droop. Why is it? And what can you do about it? That's what I'm going to tell you today. 3 solutions so you can have a smooth forehead and not have the droop. But the all-important statement is, no matter what pattern you use, and there's 3 common patterns done. There's the barcode pattern, there's the V pattern, and there's the sprinkling pattern that I like to call them. They will all lower your brow, but that in turn lowers the lids. And there's no getting around it because the frontalis muscle, that big muscle here, the only thing it does is lifts. And if you get rid of that lift, you droop. So what do you do about it? And important to understand, I'm not talking about the dreaded ptosis or lid droop. That's more from the depth or a high insertion of the muscle that lifts the lid. But in general, it's the forehead that gets people, and people want an open eye. So what do? How do you get around it? Number 1 is to go to a great provider that you know and trust, or you were referred from someone you know who goes to them. The reason is a lot of injectors don't realize that that will lower the brow because the aesthetic industry is growing so fast, we can't keep up with educating injectors that are just starting to inject. And there's a lack of a specific program really for people to go and get certified or get trained. So see somebody experienced and get a great consult. It's not right for everyone. But you can easily avoid doing any Botox in the forehead with 3 mechanisms that I use in my practice. The first one is using retinols. So I did a whole video on retinols, retinoic acid, vitamin A derivative products. There is retinoic acid, there's retinaldehyde, and there's retinol. They all can work. The retinaldehyde and retinol are converted to retinoic acid, but if you're using the right dose and consistency for you and your skin, you can get a great result with all 3. So watch my video on retinols and the retinol tutorial. That's key, that's maintenance, that's something you can do at home to avoid ever having to do neurotoxin in the forehead. Number 2, VFR, fractionated radio frequency, are my go-to treatments because it uses electrical type of energy in a fractionated way, meaning you're treating a fraction of the skin, not the whole skin, so you don't get the downtime that you would with ablative procedures. That does a couple things. One is it makes the skin glow. It gives the skin a nice smoothness. So any irregularities, acne scars, anything in the skin that inhibits light reflection, it flattens it, it smooths it so that you get a nice, not an unnatural light reflection, but it smooths the skin so you get that beautiful glow or glass type skin. And it works deeper to produce collagen because what you're missing is collagen. People at 20 don't need Botox in their forehead. Well, I guess you don't need a set of treatments. We desire them. No one needs them. But they don't need them because they have collagen. Because when they move, they aren't left with lines in the skin because it's more robust. So fractionated RF, I did a complete video on Viora's VFR that I liked. I said no Botox, no fillers, no problem. That was the cover slide or the thumbnail of that video. I'll put a link at the end of this video. You can watch that. Great treatment to avoid lowering, and in fact, that will lift the brows. So that's a benefit. Number 3 is PDO threads. And you might know it because you watch me do the cat eye, and that's not what I'm talking about here. Of course, people like it, and you can do the cat eye with the threads above the brow, but look at my brow lift PDO threads videos. By putting PDO threads in above the brow, you then get collagen formation, long-term collagen, right where you cannot put neurotoxin because it would lower you. And a lot of people are hesitant. You go into clinics and they don't do PDO threads, or they don't know about the procedure, or they're not comfortable putting something above the eye. But I do it on almost all my patients. I've been doing it for over 6 years because I want to raise the brow, not lower it. And if I can avoid using any Botox-like product in the forehead, I'm much happier. The study dose of Botox for forehead treatment is 20 units, way too much. My average is 12, and I would love my average to be 0. My goal is put none in the forehead. The number one callback to clinics is going to be forehead neurotoxin in terms of areas that it's used. You can watch my complete video on forehead lowering and brow lifts and all those things to see why, and exactly anatomically why, the forehead lowers. So Botox will lower your brow. That is proven and studied. And there are 3 ways that you can overcome that problem, because I don't want to come to you with the problem. I want to also give you a solution. But I love to hear from you. What are your solutions? What do you like to do? And I put a complete playlist up here for all sorts of things you can do at home in the comfort of your own home to have great, beautiful, glowing skin and reduce the amount of treatments you need in the clinic. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.